Okay, good morning and good afternoon for the people connected from India, because in India now is afternoon. This is the second event, special event of our telemedicine and the ICT community in the world, International Medical Informatics and Telemedicine Group, our group, the second time after the beginning of the war in Ukraine last year. You remember, many of people maybe remember that last year we very soon and we decided on the basis even of the recommendation of our government, the Minister Professoressa Messa and our President of the National Council of Research to do everything to help how the science, the technology can help in this emergent situation due the war. Just we last year were in another at the end we opened of another emergency of pandemic COVID-19. You remember now we are in towards the end of this pandemic emergency, where our community in Italy and in European level in the world help the health structure, the medical centers, in order to give them the opportunity to use digital systems in order to contribute to the fight against the pandemic. Now we are in presence of different emergencies, war emergencies, very terrible, or natural emergency like the earthquake in Syria and Turkey, or other natural or not natural emergency, like for example in Mediterranean Sea, the emergence of the migrants, for example. The world is in presence of different situations of emergency. The question is now, beside the organization and the political and the administrative helping or situation, how the science, how the technology, and in particular, how the information and the communication technologies or digital health or telemedicine can help and contribute to reduce the damage, in order to reduce the consequence of this emergency in terms of healthcare and in terms of the medical situation. We believe that the science and technology, in particular in digital technology, can support better and reduce the healthcare and reduce the damages of this emergency situation. In emergency situation, we can use sensors or geolocalization systems in order to help immediately these people civil or not, or military persons involved in emergency situation. We hope after the emergency, after the war, or after the earthquake, or after the natural disasters, we can help using innovation with this technology in order to monitor and to give rehabilitation to this kind of people. Last year, we decided to help, and Professor Pelicano will speak after about the experience of our group, our Italian situation, helping in devices, in medical devices, and other devices for this situation in Ukraine. And we hope now and after to call our health centers, in particular rehabilitation centers, to support the rehabilitation of these people, in particular people and young people, military people, now injured, minus of the guns, of the other terrible situation during the war. We have a network of these centers in different specialty, movement, ocular, neurological, respiratory, and centers. This network we can give to the list of these centers to our government, and to give some support now, and we hope after, at the end of this emergency war. So we have connection with the different colleagues in Ukraine and in the Eastern Europe, like Professor Leonid Goldberg. I don't know if he is in connection, because he lives in Odessa, and in Odessa the situation is not quite. They are without light, without energy, and last year, for example, we have the presence of the health director of the hospital in Odessa, or in other. I close this my presentation giving the speech to for welcome address and to Professor Saporito, Professor Pallavicini. They are connected. Professor Goldeschi from the University of Odessa, or Professor James Goldberg.
I'm very pleased to be with you, and thank you, Francesco, for inviting me to this important gathering. And congratulations for always arranging such a top quality event. We are all astonished of the brutality of the tragedies happening in Ukraine. I don't quite know how to react. We speak about the digital revolution always and work with digital technology, but how can we face the barbarians in Ukraine that brings up to the World War I? Networking training staff and emergency practice can detect and assist a soldier and frontline and affect a civilian with telemedicine, which is an effective and efficient solution. But we need peace to develop is further. The telemedicine born out of a spatial telemedicine and the telemedicine tools must be improved, especially those related to diagnostic distance and the medical and pharmaceutical monitoring. We, as OCCAM, we start exactly with Stolduchanskin, and we learn a lot in terms to transfer technologies and the practical application to the ICT village in Africa and Latin America. But now, military speaking, high innovative and advanced solution already exist. Field hospitals are in the front door of innovation, forefront. Just like surgical robotics, digitalized robotic center already exist in the US Army and also in Italy, in Libya, the temporary Misurata hospital, and in Afghanistan. All that hospital, they use a lot of advanced telemedicine, but unfortunately, however, they are close and limited experience. It would be useful to transfer this best practice to the civil society to help the population in need and the injured military rather than having only charity support for the population injured. All this telemedicine innovation, in fact, in Ukraine is not benefiting none. Therefore, I wish that Italy and the European countries could increase their effort to create an effective and urgent telemedicine plan for emergency and crisis capable of facing natural disaster and the civil network of hospitals and the healthcare center ready to operate in due time and with the best health sensor and robotic device for distant assistance rather than invest exclusively in the weapon. That result in great benefit for the people, inspiring also decision-making with solution overcome such barbarians. This can be achieved only if adequate means are established. This necessarily means that more funding and resources must be invested and allocate that solution to save people. So, less weapons, more telemedicine. We need to transfer also that capacity in the field. In this respect, telemedicine is an important key of the puzzle. Hoping that the final resolution from my part will be shared by all, is certain in an official by final declaration to this meeting. And I wish you a fruitful discussion. So my hope is Europeans are not so focused only in the army, the weapons, but also the army. They will share the high-level telemedicine, not only for the combat people, but also for the population. That I think is an important engagement and will open a little hope. I wish. Thank you so much.
Thank you to you, Professor Saporito, for this interesting hoping and speech with the hope for example, to use the technology not for the war, but for the life. The drones, for example, we during the pandemic emergency, we suggested to use the drones to deliver drugs, to deliver food, to deliver helping to the people, old people at the home, for example. It's possible to use the technology, the result of the technology, in particular in robotic or drones, for example, as before Professor Saporito said, to use for peace and not for war. Our community, our group, our of telemedicine and medical informatics want to stress this, to use now and after the result of technology and to cooperate with the people for the peace. I remember 32, 33 years ago, during the repression of the Piazza Tiananmen in China, you remember in 1989, in this internal situation with a lot of students died from the police, we decided 32 years ago as a community of medical informatics to stop the conference in Peking and to move this conference, for example, in Singapore. We want to say to our colleagues in Russia, that we want to stop at the moment the cooperation with them, because the Russian army is the responsible of this invasion in Ukraine. And we want to cooperate with our colleagues in order to promote the peace, the science for the peace, the technology for the peace over the world. Thank you very much, Professor Saporito, for your speech, because your organization is under the umbrella of the United Nations. Okay, Professor James Goldberg is an academic of the Academy of Health of United States. Please, James.
Yes, I would like to thank you very much for your opportunity to participate not only in this effort that you've made, but in many efforts that you make in order to provide the most important resources possible for the challenges of achieving excellence in healthcare, quality, security, economic opportunities, and evaluating healthcare policy, even in this specific program, which is remarkable. How can we evaluate this in terms of a war that has been going on for more than 1 year now, has passed 1 year. Last week was 1 year. During ecologic or during earthquakes in certain areas of our world, where we have to take care and provide care and special services for assisting populations. And finally, trying to understand how we can unite the world to use this technology so that it can be part of our opportunities for preserving peace and humanity throughout the world with health, quality, security, and sharing information always together. Now, either you put my slides on and I will just show. What you have to do is just show the slides one after the other, and I will go through very quickly, because this is not these slides are for the people that are watching and participating and the future people to know what we have done in the past and to see what we have to do for the future in terms of education, in terms of uniting all our local, regional, and national and international cooperations so that we can understand what is education, what is implementation, what is evaluation together with its pertinence to the quality, security, and economic opportunities that each part of our society shares and must understand better. As you know, I decided to send these slides, but only to use them as a resource so that the people that have engaged in this program and the people that will follow this program will see the major efforts that were made in the past so that they can step together for the future. We have only the choice of working together, understanding together, and using this resource to understand the methodologies, understand the future of this remarkable resource, which uses electronic alerts, which uses direct learning, which uses videos, which uses different simulations that can be done throughout the healthcare programs. And what is important is that we understand the education and formation resources that you will provide and we will provide all along in the future to accompany these efforts and these opportunities and these obligations and responsibility. I believe that there is no excuse for what is happening in terms of the war, as we all agree that war is not acceptable in the 21st century. We have not learned from the future, or we have not preserved what we have learned from the past. And that is one of the remarkable efforts you are making with all the different presentations internationally to try and move people to understand how to collaborate and how to use their resources and how to educate all of the populations, whether they be children, whether they be patients, whether they be people that are working throughout medical technology, throughout engineering, throughout healthcare policy appropriation, as doctors, as nurses, as professionals, and also understand the pertinence of each patient using the materials and understanding how to use the materials. How can we go to this just simulation through the last the slides so you can just see Cecilia, can you just put on the slides rapidly? Is that possible? Or if it's not possible, that is not really important. What is really important is during the course of the day that you will be able to see how we have used this information in terms of using all the experts, using all the different activities that are necessary to provide for telemedicine. Telemedicine is not just a medical solution. It is a step of engineering. It is a step of utilization of innovation. It is a step of education. And all this is due to peace and sharing all of our responsibilities together and understanding and communicating. And I would like to thank Francesco and the entire group for constantly providing webinars and scientific representation that welcomes the world to try to understand, to try to communicate, and to try to implement all of these different responsibilities, all of these different resources with specific educational tools, with specific realization tools, with specific demonstrations of what works and what does not work, with specific policy indications that help governments move from policy to practice to use of materials by all patients, by all professionals that are responsible together.
Thank you.
I would like to thank you very much for this opportunity. I would like to say that I will be listening to this program, and I believe that your efforts should be absolutely published throughout the European Union, and all of your webinars must be published, and I will make sure that they're published in the United States at the National Libraries of Medicine and of the Academies of Medicine, so that everyone can share your efforts that are remarkable in an international webinar that welcomes the world to the responsibility of quality, security, and evaluation of healthcare policies for all patients, for all professionals, and for all the world together in peace. Thank you.
Thank you for your words, special words, to stress the cooperation for research, innovation, and education. Education is very important, because in medicine we have a terrible lack of nurses, doctors, and health operators. Your speech is very important for us, to continue the cooperation in order to move the resources from the war to the civil, and to improve the healthcare services, to improve healthcare instruments, healthcare for the life approach different from the war. It's very important to use the telemedicine and tools for this field, improving education of this afternoon. We have a special tutorial for Ukrainian people living in Italy, and we want to offer them the opportunity to use this instrument of telemedicine and the sensors and the medical devices for the activity here, and when they come back to Ukraine to reconstruction of this territory after the war. Thank you very much, Professor James Goldberg. We believe in our cooperation with your Academy of Health in USA. Thanks, James.